Breast cancer, for years one of the most feared cancers in women. Today, even though cure rates have skyrocketed for many forms of breast cancer, one highly aggressive form has eluded those outcomes. It's called inflammatory breast cancer, or IBC. It's rare. It's highly aggressive. And it's hard to diagnose.
Inflammatory breast cancer presents as a redness of the breast. And by the time the redness is noted and the breast cancer is confirmed, a lot of time the disease has already spread to other locations.
It would be very typical to hear a story that someone woke up one day and one breast was swollen and red and the nipple had inverted. And the typical thing that happens is you go to your primary care physician and the more likely thing is maybe it's infected. And it's not until you really push forward and get a biopsy that you realize this is a cancer and not an infection.
MD Anderson Cancer Center has a long history of treating patients with IBC. It was apparent early on that treating this form of breast cancer was vastly different from treating other forms, and IBC patients needed dedicated experts for diagnosis, treatment, and discovery. The Texas legislature created the $4 million IBC program at MD Anderson. The Morgan Welch Inflammatory Breast Cancer Clinic was named after a young woman treated for IBC at MD Anderson who lost her battle at the age of 24. The Morgan Welch IBC Clinic treats both newly diagnosed and previously treated patients. It sees over 80 new IBC patients a year.
Our uniqueness of our clinic is that we have specialized surgeon, medical oncologist, imaging people, radiation oncology, pathologist working together. And that makes a big difference in terms of the outcome of this aggressive disease. The weekly IBC multi-disciplinary team clinic ensures that patients are seen in efficient back-to-back appointments so that we can begin treatment as soon as possible. Seeing the patient together upfront is a best practice to confirm the IBC diagnosis and formulate the best tailored treatment plan.
As in the treatment of all cancers, the ultimate goal with IBC is to improve survival. Research is key. The multidisciplinary team is focused on understanding how the tumor and the microenvironment work together in IBC. Patients have access to clinical trials that are designed specifically for IBC.
We have a large clinical database, so we have more than 1,000 patients' outcome in the past several decades. We've been collecting samples of the blood and tumors, which has really helped us to understand the disease.
One of the first things we did was we took our patient tissue data and we combined it with two other international institutions to create a large enough data set that you could really begin to robustly understand how is IBC different from non-IBC. And there have been enormous important studies that have come out of that work.
I think we're really coming to a point of creating the best infrastructure to fight this disease, to really make a big difference, not just for MD Anderson, but any patient who has inflammatory breast cancer.
If it wasn't for the clinic here at MD Anderson that was open the year before I was diagnosed, I don't think I would be alive today. What I see looking forward for the Morgan Welch Clinic is the advancement of science that is going to literally make cancer history, that one day we will be reading about inflammatory breast cancer in a reference book of a disease that is now eliminated.